Hi, everyone. I am Dr. Lauren Kriz. I am a pelvic floor physical therapist, and with me, I have.
Dr. Summer Samori, also pelvic floor physical therapist.
And we have asked Dr. Amanda Olson, who is also a pelvic floor physical therapist, to join us today. I'm doing a series of interviews related to National Orgasm Awareness Day. And so there's a lot of components that can impact an individual's ability to have a successful and fun orgasm. And your pelvic health is one of those pieces. And so, with Dr. Amanda joining us, I have a little bio for her. Dr. Amanda Olson is a pelvic health physical therapist, entrepreneur, author, and global educator with a passion for empowering men and women in advancing conversations around pelvic health. She has dedicated her career to breaking stigmas around pelvic health, supporting patients with conditions including cancer, incontinence, pelvic pain, pelvic organ prolapse, endometriosis, and MRKH, and developing innovative solutions to improve quality of life. Dr. Olson is the president of Intimate Rose, which is a very cool company that we're going to talk about a little bit more. A successful pelvic health device company that includes tools for managing pelvic pain. She holds multiple patents and has authored 6 peer-reviewed journal articles, as well as the book, Restoring the Pelvic Floor for Women. She is also the recipient of the Elizabeth Noble Award. Congratulations, which is the highest honor bestowed in the field of public health. She has collaborated with clinics worldwide, transforming lives through her tools, teaching, and consulting. As an advocate for patients with sensitive issues and medical innovation, Dr. Olson is committed to bridging the gap in pelvic health or in pelvic and women's healthcare and bringing education to understand patient populations. Thank you so much for joining us.
Thank you for having me.
So as we get started here, tell us a little bit more about Intimate Rose. What is it? How did it come to be?
Intimate Rose is a company where myself and my team create pelvic health tools that ultimately our primary goals are to create the safest and most comfortable products for everyone to move pelvic health forward throughout the world. So our tools are all FDA compliant. We use a really soft, smooth silicone to address a wide variety of different pelvic floor symptoms and issues. And I also wanted to make them the most cheerful and bright and pleasant to look at tools so that they're not feeling stigmatized or shameful. I want to remove the shame. So they're bright and they're cheerful and they're there to help.
And so when you say tools, what does that mean and how would somebody use them?
So we have many different tools and we're always creating new ones. They range from a tool like a set of vaginal weights that are intended to help people build strength when they have pelvic floor muscle weakness. They're there to also help direct the brain as to where the pelvic floor muscles are located and to build endurance and to build power, which is important for climax, especially for women. The orgasm is a wave of contractions of the pelvic floor muscles. And when the pelvic floor muscles are responsive and have good timing and speed, that can increase pleasure, no matter how it comes. Additionally, we have vaginal dilators. These are a tool for people who may be experiencing pelvic pain or vaginal pain, and they start as small as my pinky and they gradually get longer and wider until they can be quite large, but the end goal is the goal that's specific to the person. So if that goal is to use a tampon pain-free, they might be right in through here. If the goal is pain-free speculum, this might be their end goal. And then if the goal is pain-free intercourse, depending on the size of their partner or their dating intentions, they would go into the larger sizes. But the goal with the dilators is to retrain the brain that something entering it is not a threat. It's to retrain the sensory system and to retrain the vaginal tissue itself to improve flexibility, length, and width. People might struggle with that if they've had a history of trauma or abuse, or if they have this involuntary guarding that happens that's just a protective response of the brain that just requires some retraining, a little bit like learning how to ride a bicycle, just training the muscles when to relax versus when to contract. And then for people that have low estrogen, whether they're postpartum or they're perimenopausal, or if they've had like a cancer treatment like radiation or surgery, the tissue might just lose flexibility, and that can make intercourse or having that speculum exam very difficult. So goals vary for the dilators, but they are there to help train the body for penetration. And then we also have anal dilators, which can be useful for people who have had radiation to the anus or the colon, or they've had surgery, and they might be experiencing rigidity of the anus that makes bowel movements uncomfortable or challenging. They can also be used in service of training the body for anal penetration in those that have that goal. Very similar to the vaginal dilators. The protocol looks a little different, but it's a similar principle, just training the brain, training the tissue for flexibility. And then we have vaginal wands, or I'm sorry, these are pelvic wands. They can be used vaginally or rectally. But the intention behind this is to help improve mobility, address any trigger points or tender points in the pelvic floor. They can be used rectally or vaginally on either end. So they can be used by any gender, any person to be able to manage pelvic pain. And then we do have two that vibrate. They have 10 frequencies of vibration, which for a person who's experiencing pain is helpful to relax the muscles, get blood flowing to help heal the tissue, and then could certainly be used as a stimulant for sexual pleasure if that was a goal. We just call that off-label use.
Perfect. There's nothing wrong with that.
That's exactly right. Helpful tool.
That's great. So you alluded to any gender could use these tools, right? So, a lot of times we talk about women having pelvic pain and how that can impact their ability for successful intimacy with their partner. But men also have a pelvic floor muscles too, right? So do you help educate on how your tools can be utilized for men, and in what scenarios might they want to use your tools?
Absolutely. So on our website, we have a whole men's health hub, and it is dedicated to addressing the wide different issues that men might face, whether it's post-prostate incontinence or post-prostate scar tissue that's leaving them with erectile dysfunction or just general erectile dysfunction issues in general, or pelvic pain or post-radiation treatment. I just held up the purple one, but we have blue ones too. But regarding pelvic pain, the blue wand, I made it specifically for people who like blue. Plenty of women buying the blue wand, but specifically to make the men feel welcome. The blue wand can be used rectally. Here, the long, thin end can come in through the anus and address trigger points, tender points, muscle rigidity. So it's just the same way as you would use a Theracane to get a knot out in your neck or your back. The pelvic floor muscles likewise can have those. So the pelvic wand is a really powerful tool. Also made an orange one that's extra long and bendable. That can Oh, well, look at it can be bent to adapt to any unique anatomy. So if they have trouble reaching back behind, they can do that, and it's orange. So it's got the same ends as our original wands, but it's extra long and bendable. So those are some tools to help manage pain. And then depending on the goals of the man, we do have anal dilators, if that is a goal. So we can address the pain, we can address the sexual dysfunction, and the vibrating component on the pelvic wand can be really useful to stimulate blood flow to the tissue if they are experiencing erectile dysfunction, or they're post-operative or post-radiation and they need to help heal. One of the important parts is just getting fresh, healthy blood flow and oxygen to that tissue. So the vibrating wand can be a really helpful tool.
Fantastic. I love that. So
Yeah.
do you want to jump in right off hand, Summer?
I actually have a patient that I'm using the rectal dilators for a J pouch.
Oh,
And
fantastic.
he has to go in annually for rectal strictures, for anal strictures. And so she said, I would love to be able to manage this independently. And I said, well, I have tools for you.
Yes. Absolutely. And that is, we had that population in mind when we created them. And also they can be a powerful tool if people have stoma and they're looking to get it reversed and they need to retrain their body and how to have a bowel movement. The bulb can be used to retrain, drop, relax, and expulsion.
Right.
for stool.
Fantastic. So I feel like sometimes there's this really narrow view on who can experience pelvic floor dysfunction or pain, or who even wants to improve their ability to orgasm, and enjoyment with that. Have you seen in the populations that you have worked with, or who purchases your product, is there like a typical age range, gender diagnoses that you see, or a whole gambit? Can you share a little bit about who might benefit?
Yeah, as a provider, I always joke and say there are hundreds of ways to injure your pelvic floor.
Right?
I started my career as the patient on the table with a drop from 40 feet onto my bottom, annihilating my pelvic floor. I could be any gender and age to have done that.
Right.
Just happened to be me. So,
You're
you know,
lucky
a slip
too.
and fall on ice, a fall on a ladder, guarding response, those know no gender and know no age. So really and truly in my clinical practice, I saw all the people I still see patients, but teaching and running the business is my primary mode of operation these days. But I saw peds, I saw men, I saw women, I saw trans people. And so yeah, pelvic floor dysfunction can seek you out regardless of
Does not
who and what
discriminate.
you are. And additionally, there are some predispositions of people born with a vagina. So pregnancy, hormone fluctuations that affect vaginal tissue, ovaries can create really fun endometriosis adhesions. I'm also one of those people. So there are some specific things that women do experience that require some extra attention and extra TLC, but you know, men can have prostate cancer and colorectal cancer as well. So for that reason, it's just one of those things that you're not alone. If you are experiencing pelvic floor dysfunction, you are in good company. It affects, I think the statistics now are something like 1 in 3 women throughout their lifetime and at least 1 in 5 to 6 men. And it's just part of being a person is using the toilet and sexual health. And so at some point in your life, regardless of who you are, hormone changes or an injury or an accident may find you. And that's why we are here as pelvic therapists, is to help you. And so for that reason, the tools are approached, I would say with the vaginal dilators, we roughly see like 17 to 90. We should all be so lucky. And with the wands, roughly 17 to 80, all genders, all backgrounds. Rectal dilators, likewise, reversal of stoma, people that have inflammatory bowel disease, cancer treatments, those kinds of things. And then vaginal weights are specific to people with a vagina. Generally, we see people approaching them in their early 20s to 70s, just to help rebuild that coordination and strength. So I try to create an environment where everyone feels welcome and everyone feels cared for.
So with the vaginal weights, again, I feel like a lot of times when we think about like sexual health, especially for women, let's say, we think about it from the pain standpoint, right? It's not comfortable or fun to have sex if it's painful. You start to have an aversion to it and you're not interested in that way. But when you were talking about the vaginal weights, you brought up this really great point that probably isn't talked about enough, that the strength and coordination of your pelvic floor muscles can enhance your ability to orgasm and the strength of the orgasm, correct?
Yes.
Is there anything else that you can add to that, to kind of like shape the conversation or break the stigma on the ability to change that?
Absolutely. I mean, I think from a high level standpoint, orgasm is so interesting because the way that it's physiologically achieved is so different based off of your hormone status, sometimes your genital status, and then we have the psychosocial, emotional overview.
Right.
And because of all of those things, it is much more of like an orchestra than it is like a on-off switch, for men and women and trans people. So when we're thinking about how orgasm is achieved, like comfort level with your partner, comfort level with your own body, and then also your body's response to sexual stimuli are all key factors. So when we think about pelvic floor muscle strength, what I don't want people to hear is that, oh, if I just get my pelvic floor stronger, sex is going to be a lot easier, because all of those other things need to be in place. And we can help from pelvic therapy standpoint, physical and occupational therapy, but also that's where if you are struggling with staying present or a history of trauma or abuse or connection with your partner, sex therapists, counselors, EMDR, cognitive behavioral therapy are really important, because it's going to affect how your body is responding to your brain and what's going through your system and your sensory system, and how that's interplaying with the person who also has their own brain and their own body and their sensory system.
Right.
But it's a long way of saying pelvic floor muscles that are coordinated and strong and adaptable and flexible, so strength and flexibility, will give these pleasurable rhythmic contractions when you achieve orgasm. And the fun thing is, for people with a vagina, that can be strung out in different ways and elongated depending on how you are being stimulated. And we have the ability to sort of reboot and go again in a shorter amount of time versus, say, people that have penises. Once they achieve orgasm, they're usually out of commission, at least for a little while, just because of the way that their physiological system works. So that makes us kind of special.
Yeah, very cool.
I agree.
And then with these tools, I generally will always recommend them as part of a patient's home exercise program. However, that being said, there are some people who look at them and go, nope, I just can't. What advice do you give to people who maybe could really benefit but are fearful of utilizing them, or just have this stigma on, it looks too much like a toy, I can't do that, I don't even look at my own body parts. What do you say to those folks?
Well, first and foremost, at Intimate Rose, it's really important to me that our clinicians have samples in clinics so the patient can get graded exposure to it. So being able to see it, yeah, it's a priority for me as a clinician, so that the patient can touch it and feel it and see it and see that it isn't so scary. Because on a website, when you're looking at something that maybe looks like a snake, we're not really sure.
Right.
The curvatures all have very specific anatomical reasons for why it's shaped the way that it is. But it's helpful to see that it's not so scary. The other thing I liken it to is, if you tore your ACL, you would be given a knee brace. And those look pretty clunky and weird, and they're kind of annoying to put on, and you got to put it on just right. This strap has to go first, and then that strap. And you change the settings as you gain knee range of motion, and all of those things are part of your healing process, and we don't second guess that. Just because it's a genital doesn't mean that it should be regarded any different. We are still thinking about pelvic floor muscles that are muscles. They have tendons, they have nerves, they have blood vessels, and they operate very similar to a shoulder. There's a lot of different things that rotate and contract, and it just so happens that they support the organs that we have sexual function and toileting function with. So bowel, bladder, sexual function. So from that perspective, I like to remind people that this is a part of your body and we are here to address it, and these tools are here to help. You can never force a person to do anything, but I think likening it to, this is just orthopedics. It's just in a different part of your body. These are still muscles. We're still just retraining function here, and just giving them time. Sometimes just letting them feel it against something totally innocuous like their forearm or their abdomen, and just getting a sense of it can be really helpful in calming their nervous system. And then always too, if they do approach the space where they're ready to buy the tool and have the tool, is reminding themselves that this is my tool so that I can boom, and tether it to the goal. This is my tool so I can have my medical exam. This is my tool so that I can be with my partner. Or this is my tool so that I don't leak urine.
Right.
and I'm to have better orgasms.
Right? Don't forget about that.
Yeah, but having them remember the why and the purpose of it. And very specifically with the dilators, I created them as a cylinder to not, I mean, it's going to look valid because it is long and slender, but to not have anatomical things on it because not everyone using the dilator are the types that have intercourse with a
Right.
penis. So it's a mobility tool, just like a foam roller, just like a knot hero, the
Irritating.
therapy where you get the knots out. It's similar purpose. We're working with muscles.
I love the idea of kind of comparing it to a foam roller, or I'll use the Theracane example a lot, or even just a knee brace, right? So that's great. I appreciate that.
I think it's fantastic that you are one of the only dilator companies that offers individual purchase of individual sizes. Sometimes they're too intimidated to buy an entire set. So I'll say, why don't we start with the one that you think you'll be comfortable with, and you can always buy up later. So I think that's really fantastic that you offer that option.
Absolutely. Everyone has a different goal and a different need. And we're the only silicone dilator company that's FDA cleared. And
Right.
so are the safest on the market.
And you spent a lot of time getting that FDA clearance, correct? That was not an easy process.
No, it was not.
So congratulations on that too. You're welcome. Laura, was there anything else that you wanted to add?
No, I think Amanda answered all of it.
Amanda, is there anything that we missed that you would really like to make sure people thought about or understood or wanted to share?
I think just remembering that when it comes to an orgasm, it's a lot of different things happening. So be graceful with yourself. Communication is always really helpful. And that if you've had experiences in the past that were less than desirable, doing all the things you can in service of yourself and your body and your heart are really good to do. And that it's always different with a different person. So depending on how that's looking, and you can always just do it by yourself too.
That's right. Very good. All right. Well, thank you so much. We appreciate you spending time with us today.
Thank you so
Yeah.
much for having me.
Thank you, Amanda.